Member for Lanark, Frontenac, Kingston.
Speaker, my question is for the Premier. The Premier told the people of Ontario that they have a right to know what he knows. The Premier also gave Dr. Williams the power to postpone medical procedures. The FAO reported in April that over 50,000 people have been denied medical health care, and that number is rising by 12,000 every week. Over 100,000 people have been denied medical procedures. Minister, how many people have died waiting for heart surgery, organ transplants, and other procedures? How many more are suffering because they cannot get cataracts, knees, and hip surgeries? Minister, will you tell the people of Ontario how many innocent people have died waiting for the Premier's emergency powers to end?
I thank the member very much for that question. It is an important issue, I know, to many, many Ontarians who've been waiting to have their scheduled procedures done, whether it's for eyes, whether it's hips, knees, whether it's for cancer surgeries or heart surgeries. This has been very, very difficult for very many people, and we are several 100,000 procedures behind. But we needed to do that in order to create the space in case we had a surge in COVID cases. Thanks to the work that was done by 14.5 million Ontarians to practice physical distancing, to take all of the necessary health measures that had to be done, we fortunately did not see our hospitals overwhelmed. But that very well could have happened. We very well could have been in the same situation as Italy and Spain and other places around the world. Fortunately, that did not happen in Ontario, and we are now working to get those procedures back in place, which I'll speak to in my supplemental.
Again to the Premier. We have flattened the curve. The dire predictions of hundreds of thousands of deaths were wrong. Yet while flattening the curve, the Premier has also flattened our economy, has also extinguished all social interactions, and has stifled our democracy and our freedoms. In April, the Premier told the people of Ontario that they deserve to know what he knows. Minister, over 100,000 people have been denied necessary medical health care. To get the real picture of COVID, we need to know the consequence of your actions. Minister, will you provide the number of preventable deaths caused by the decisions taken by you and the de facto Premier, Dr. Williams, or will this be kept secret and hidden?
I'll start with this, Speaker. There has always been a triage factor in place for people that have been waiting for cancer surgeries, heart surgeries, other surgeries that could be life-threatening, based on a pandemic plan that was developed by Cancer Care Ontario many years ago after SARS, so that if people were in a situation where their life was at stake and they needed to have surgery, they would have had surgery by now. They would have. What has been looked at is the type of surgery people have, how aggressive the cancer might be, whether the situation is going to place them in a life-threatening situation. And if they needed the surgery, they would have had it by now. There's been some modelling done with respect to deaths, but no one knows the exact number. But what I can tell you certainly is that if people needed to have that surgery on an urgent basis, they would have had it. Now we're in a position, thankfully, where we've asked every hospital to prepare a readiness assessment to start those surgeries again, and that assessment is going to be reviewed on a regional basis, and it's going to be based on the number of patients that they have COVID, the space that they still have left in their hospital once they start taking on these elected procedures, how much personal protective equipment they have independent of the pandemic supply, whether they have.
Thank you very much.